1. The opticon, ethyl hydrocuprine hydrochloride, disc is used for the identification of Streptococcus pneumoniae, Haemophilus influenza, alpha hemolytic streptococci, group A beta hemolytic streptococcic. Correct answer. Streptococcus pneumoniae. Opticon susceptibility is used to differentiate S. pneumoniae, which are susceptible, from other alpha hemolytic streptococci, which are resistant. 2. In the opticon, ethyl hydrocuprine hydrochloride, susceptibility test, if there is a zone of inhibition of 19 to 30 mm surrounding the disc following overnight incubation at 37 degrees Celsius, the colony most likely consists of Correct answer. Streptococcus pneumoniae. Opticon susceptibility is used to differentiate S. pneumoniae, which are susceptible, from other alpha hemolytic streptococci, which are resistant. 3. A mother brings her 3-month-old baby to her pediatrician because he has been progressively more listless for 3 days. The baby has been constipated and has refused to nurse or take a bottle. Upon physical examination, the physician notes that the baby has a sluggish papillary reaction to light, a weak gag reflex, and poor anal sphincter control. The physician tentatively diagnoses this 3-month-old with infant botulism. Which test would be the most reliable for confirming this diagnosis? Correct answer. Culture of the baby's stool. Infant botulism is the most common form of botulism reported in the United States. Most infants acquire the infection by ingesting foods contaminated with spores of the Clostridium. The most common contaminated food product is honey. Although spores and toxin may be recovered in honey or other contaminated foods, detecting these in the foods is an insensitive way to confirm the clinical diagnosis. The most sensitive method for confirming the clinical diagnosis is culturing stool specimens for the bacterium. Blood cultures should not be processed. Serum and stool specimens should also be collected and assayed for toxin, with stool specimens being considered as more reliable than serum specimens. Antibodies against the toxin would not be detected. 4. AD test is performed on an isolate of Staphylococcus aureus to determine inducible clindamycin resistance. Based on the results seen in the image, how should the erythromycin and clindamycin be reported? The correct answer. The image displays a negative D-test result. There is no flattening of the zone of inhibition around the clindamycin disc adjacent to the erythromycin disc. Thus, there is no inducible clindamycin resistance, and the isolate is reported as clindamycin susceptible, while the erythromycin is reported as resistant. 4. Which of the following antibiotic combinations is useful for confirming the presence of extended-spectrum beta-lactamases, ESBLs, in E. coli? The correct answer. Extended-spectrum beta-lactamases, ESBL, are inhibited by clavulanic acid. Confirmatory tests of the presence of ESBL are based on the enhanced activity of a beta-lactam antibiotic, usually cefotaxime or ceftazidime, when it is tested with clavulanic acid compared to the activity of the beta-lactam tested alone. 5. Enzymatic drug modification is a mechanism of resistance for which antimicrobial? The correct answer. Aminoglycoside modifying enzymes alter aminoglycosides, such as gentamicin, leading to poor binding to the bacterial ribosome. Resistance to levofloxacin, vancomycin, and sulfamethoxazole results from non-enzymatic alteration of the antimicrobial target, which reduces antibiotic binding or activity. 6. Which of the following is the most important variable in the recovery of organisms in patients with bacteremia? The correct answer. The volume of blood collected is the most important variable for recovering organisms in patients with bloodstream infections. Adult bacteremia often has low magnitude, and there is a direct relationship between blood culture positivity and the volume of blood collected. Multiple blood culture sets should not be collected from a single venipuncture because of contamination risk. Terminal subculture of blood culture bottles at 5 days is no longer recommended. Chlorhexidine for skin antisepsis helps reduce contamination but does not affect organism recovery. 7. A 24-year-old man presents with pain on urination and urethral discharge. A gram stain of the discharge is seen in the image. What is the most likely identification of this organism? The correct answer. Diagnosis of gonococcal urethritis in adult males is often made by observing gram-negative diplococci within or closely associated with neutrophils in smears prepared from urethral discharge. The gram stain in males has a sensitivity of 90% to 95% and a specificity of 95% to 100% for diagnosing gonorrhea in symptomatic males. 8. A 10-year-old child with cystic fibrosis presents with cough and shortness of breath. Her sputum gram stain is seen in the image. Based on the gram stain, what would be the best medium and incubation condition to optimize recovery of the organism seen? The correct answer. The gram stain demonstrates numerous neutrophils and small, pleomorphic gram-negative bacilli suggestive of Haemophilus. H. influenza is an important cause of lower respiratory tract infections in patients with pre-existing lung disease such as cystic fibrosis. Haemophilus are fastidious, and require the use of an enriched medium such as chocolate agar and incubation at 35 to 37 degrees Celsius in a moist environment supplemented with 5% to 10% CO2. 9. A reliable test for distinguishing Staphylococcus aureus from other staphylococci is? The correct answer. Coagulase test, positive in Staphylococcus aureus, negative in other staphylococci. Reliable distinguishing test. Catalase test, distinguishes Staphylococci, catalase positive, from Streptococci, catalase negative, not between Staphylococci species. Oxidase test, used for gram-negative bacteria, not Staphylococci. Opticant susceptibility, used to identify Streptococcus pneumoniae, not Staphylococci. 10. A urine gram stain shows gram-positive cocci in clusters. The organism tested catalase positive. To speciate this organism from culture, the technician should perform a coagulase test and the correct answer. The organism in this urine culture is a Staphylococcus species. Coagulase will differentiate S. aureus from coagulase-negative Staphylococci, CNS, and novobiocin susceptibility will differentiate S. saprophyticus from other CNS. S. saprophyticus is a common cause of urinary tract infections in young females. 11. Viridans streptococci can be differentiated from Streptococcus pneumoniae. The correct answer. Bile solubility testing of alpha-hemolytic streptococci differentiates S. pneumoniae, soluble, from other alpha-hemolytic streptococci, such as Viridans streptococci, insoluble. 12. Which two diseases are usually preceded by infection with beta-hemolytic streptococci? The correct answer. Non-infectious sequelae associated with infection with Streptococcus pyogenes are glomerulonephritis and rheumatic fever. 13. A gamma-hemolytic streptococcus that blackens bile esculin agar but does not grow in 6.5% NaCl broth is most likely. The correct answer. Group D streptococci and enterococcus produce a positive bile esculin test. However, the correct answer. Group D streptococci and enterococcus produce a positive bile esculin test. However, of these two, only enterococcus grows in the presence of 6.5% NaCl. 14. Gram stain examination from a blood culture bottle shows dark blue, spherical organisms in clusters. Growth on sheep blood agar shows small, round, pale yellow colonies. Further tests should include the correct answer. The gram stain and culture growth describe a Staphylococcus species. Catalase production confirms that the organism belonged to the genus Staphylococcus, and coagulase is used to differentiate S. aureus from coagulase-negative Staphylococci. 15. Gram-positive cocci in chains are seen on a gram stain from a blood culture. The organism grows as a beta hemolytic colony. Further tests that could be performed include the correct answer. Bile esculin, PYR, bacitracin, and hippurate are biochemicals/tests used in the presumptive or definitive identification of beta hemolytic streptococci such as S. pyogenes, S. agalactiae, and Enterococcus. Mahone 2006, p. 387. Bile esculin positive in group D streptococci and Enterococci. PYR test positive in S. pyogenes and Enterococci. Bacitracin susceptibility used for S. pyogenes, Group A. Hippurate hydrolysis positive in S. agalactiae, Group B.